Since the start of the COVID-19 immunization program, 192,942 doses of COVID-19 vaccine have been administered in British Columbia. 36,923 of those were second doses. Yesterday was the highest number of doses were administered in any single day. 12,250 people received a COVID-19 vaccine in British Columbia yesterday. This is very good news because with every individual that is protected through vaccination, we are all safer. The preliminary evidence from our immunization of our elders and seniors living in long-term care facilities is actually very encouraging. We are seeing a decline in outbreaks, and we are seeing a local assessment of effectiveness has shown us that there's substantial protection in the frail elderly from vaccination. This is a very important finding because this is the population at highest risks of severe illness, and it's not a population that always responds particularly well to vaccines. So this is actually an extremely good finding for us. We have not yet eliminated outbreaks completely, but we have seen strong results of vaccine effectiveness. A little bit about where we are today. This has been a long and difficult journey for many of us, but with highly effective vaccines being administered throughout BC, we have every reason to feel encouraged. Taking the preventive measures to prevent COVID-19 are like other healthy behaviors. It can be more challenging some days than others, and we do better than some days than others. At this stage of the pandemic, it is key to be supportive of each other and focus on the things that make a real difference. Staying at home when you are sick, avoiding gatherings, following the safety plans of your workplace and school, and getting tested if you have symptoms of COVID-19. And if you do test positive for COVID-19, please continue to work with your local public health who are there to protect you. Contact tracing and outbreak management remain key components of COVID-19 response because this virus tends to spread through clusters and known chains of transmission. So when a notification of an exposure in your school or workplace occurs, you have a role to play. It means the system is working for you and working for all of us to protect us.
I just want to say with respect to the immunization campaign, yesterday was our largest day, 12,251 people immunized. More than half of those were second doses yesterday, reflecting the need to do that work. So 5,280 were first doses, 6,971 were second doses. I would say this about it: 192,942 doses delivered. The Pfizer vaccine came in the middle of the week, and yesterday we had our largest day of immunization so far, and we'll be having a similar one today. The immunization campaign in British Columbia, the effort in British Columbia, has been, I think, delivered at a very high level by our public health teams, and I wanted to publicly thank them for that. We set out what our priorities were, and you can see the long-term care and the assisted living priorities have been very significantly met, and we are currently meeting our priorities with respect to second doses. With other vulnerable communities, that's true as well, including rural and remote Indigenous communities. In short, the delivery to date by our public health teams of the immunization campaign, and the credit for that is really for all of the people involved, the health science professionals and the nurses and the doctors and the healthcare workers involved who've done an outstanding job, and the communities that have worked with them. I think they've done exceptionally well. Obviously, we would like to have more vaccine. The only issue holding back the immunization campaign ever at this stage is supply. But I wanted to just acknowledge that so far the campaign has been delivered on the ground in a way that should inspire confidence in everybody, and I'm very proud of all of the teams involved. Many people who are over 80 who will be expecting to receive their immunizations in the month of March are obviously interested in that, and we'll be providing more information about that shortly. But in general, if you are in the general population, in other words, you're not connected through home support or living in independent living or others, you can expect to be vaccinated between March 15th and the end of March. And if you're connected to the healthcare system, for example, you receive home support, you'll expect to be vaccinated in general between March 1st and March 15th. More information about the details, the websites, the numbers to call in will be provided in a detailed plan coming forward. But people can have confidence that just as we've delivered so far, we're going to be making every effort to do that well and effectively.